My name's Tom Howell. I live in Bellevue, Washington with my wife Corby. And in October of 1999, I was diagnosed with colon cancer. I ended up having a colorectal surgery, part of my colon and removed, and went through about 6 weeks of radiation therapy and 6 months of chemotherapy. And after about 5 years, I thought I was pretty much done with cancer, and I went in and had a blood test, and it indicated a slightly elevated marker. So I went in for some further tests, a CAT scan, and they determined that the cancer had metastasized to my lungs and lymph system. So at that time, I went through another round of chemotherapy that involved oxaliplatin, which resulted in some neuropathy, and was permanent. And that worked for a few months, after which the blood markers started going back up, and so I started a third round of chemotherapy. This was the last round available, short of going in for clinical trials. And so to prolong the effect of it a little bit, after halfway through the round, after 3 months, my chemotherapist, or my oncologist, said to go ahead and take a break for 3 months, and then we'd finish it out, and then possibly look at clinical trials. Well, during that period of time, I started looking around at alternatives, because I didn't particularly want to be involved in a clinical trial if I could avoid it. And this was the last treatment that had been proven and approved that was available for colorectal cancer. So I got on the internet and started looking around at alternatives, and there was a plethora of information out there. We ended up looking at several clinics down in Tijuana, Mexico. We kind of narrowed it down to that area to go ahead and pursue this alternative treatment through the Issels Clinic down in Tijuana. And we went down there in early May of 2006 and spent a month at this clinic receiving high doses of antioxidants intravenously. We received these vaccines, we received their blood treatments, and we were put on a diet. When I say we, my wife came with me. The treatment includes a companion, joining you, which was really nice, because I had somebody that was there with me that could support my this treatment, and basically what involved learning how to live a different lifestyle. And so we went down there, and the Issels Clinic taught us how to live this different lifestyle in the way of eating differently, taking supplements. They developed these vaccines from my own blood and taught us how to administer these vaccines, which we did for 6 months after returning back home to Seattle. Well, after a month of this treatment, we returned home and we continued with the diet, which was quite a transition. It was, from what we were doing before, it was a lot different, and it took a little bit of trying and a little bit of practice to get it down. But we found that after a while, it really wasn't that hard to get into a new mode of eating, and making juice at least once a week, We've continued that for the past year, and I feel like that's a critical part of the treatment. We went through the entire 6 months of administering the vaccines every 2 weeks. My wife Corby did that, which I'm really glad for. And that was a year ago when I got back from Mexico. My CEA counts were around 11. Today, actually, I just got results about 2 weeks ago from my last blood test, and my CEA count was 1.9. And the normal range, the CEA number is for colorectal cancer, and the normal range is 0 to 5. So 1.9 is in the lower end of the normal range, and I feel pretty good about that. In the last several months, I have been able to return to work full-time, and I have regained my health and have been really concentrating on regaining my musculature and my physical conditioning. And that has been working really well. When I was going through chemo, it was pretty much impossible to maintain physical conditioning and health. And over the last year, though, I've really been able to focus on that. And for example, just a week ago, I went on a hike of 12 miles, and it wasn't too bad at all. And I plan on doing a lot of backpacking this summer. I really enjoy the out of doors and enjoy getting out and doing things like that. I've been able to get to the gym and 3 times a week and work out for about an hour of aerobic exercise. And that is an area that I really have not been able to pursue for a long time until just recently, and I feel like that is attributable to the treatment, the alternative treatment that I've received for my cancer.